Use my 5 minutes as efficiently as I can, keep my questions short, but it would be remiss of me not to put it in perspective. This morning I pointed out in 8 briefing documents in April, nursing homes didn't appear at all, except for 2 sentences. So that tells me that no priority was placed on nursing homes as a concern. And when it was mentioned, it was to say on the 1st of April, screening will be introduced twice a day for staff. Was screening introduced? How many staff have been screened? How many tests have been carried out? Tests were to be prioritised for staff. In relation to the nursing homes as well, please clarify if there's a cluster of 2 or if 2 have been infected that no more tests is carried out. Can we put that to bed and tell me that's not correct? In relation to the private hospital, you've already mentioned you're going to publish that. I welcome that. In the meantime, can you clarify for me, because I've received urgent representations in relation to, I was going to say ordinary surgery, but abnormal surgery in relation to somebody with cancer, for example, of the uterus, and there's a delay on that, they cannot get treatment. Diagnosis has been given. Clarify that situation for me. Specifically on the questions tabled written, perhaps you give me a written answer in relation to the length, rather than go through it now. You'll see it there in my own name, how long people are waiting and so on. Then there are 2 questions in my colleague's name, Deputy Collins and Deputy Pringle, in relation to PPE equipment. And again, it's all our experience on the ground that people are coming forward saying, we want to do PPE equipment, we want to work with the government. Now, you've quickly referred to some website or something. Can you please clarify what is the situation? Because people want to come forward, very much so. In relation to over 70s, and I'm glad it's been clarified that they haven't been ordered to stay at home. It's a strong recommendation. Certainly that wasn't clear to them. And I think it's time to reflect on that policy. I understand the necessity for the background to the policy. But at this point, can we not reflect on it and see, can we ease up in the sense of saying to our people who are over 70, who have worked all their lives for this country, we treasure you. We want to thank you for what you've done for us. And I think we will now share that with the younger people. So at a particular time, they can leave the home and the rest of us will stay inside. Now, I really think serious consideration should be given to that. In relation to the ethics document that you referred to, given by the Department of Health, I think on the 3rd of April. I read that. It's quite general and it gives a background. However, since I got the opportunity to table the written questions, it's come to my attention in a tabloid that there's a points system in operation in Celta and the west of Ireland. Has that been brought to your attention, Minister? Is there a points system in operation, and where, for example, somebody that's over 80 gets an automatic points number of 7 and 8? Now, I don't want to waste time on it. You're aware of it. Are you aware of that document? Have you seen it? Is that actually happening? Thank you very much.
Thank you. Earlier, Minister, I spoke of the really good work that has been undertaken by frontline healthcare staff in our acute hospitals, the HSE, the department, yourself, and all the other frontline workers. And I want to recognise that. But nonetheless, Minister, as many deputies have already said, there is a sector that is experiencing a major crisis. That's our nursing homes and congregated settings. Now, I want to emphasise that I'm very concerned that none of us in this House want to raise the fears of those in nursing homes or their families. But if there's a place for questions to be asked, it's surely here. So first of all, I want to ask you to give a response to the comments of Dr. Jack Lambert. Many have quoted them here today when he spoke about the situation in the nursing homes as an emergency and a catastrophe in the making. And just 2 nights ago he said, and I thought this was a shocking statement, and I would like your response. He said, there isn't a joined up plan. The nursing home patients are suffering, many of them dying, and probably unnecessarily. So I'd like to hear your response to that. And the second thing I want to speak about is, while I recognise that many people in care homes are quite frail and vulnerable. Some are not. And equally in congregated settings throughout the country, while many residents have underlying conditions, they're not essentially that different from the rest of the community at large. And TDs have spoken here today that many families and individuals have real concerns about those in nursing homes receiving appropriate care. And we have seen many examples from people in the community who are older, surviving COVID. We had an 82-year-old man walk out of Sligo University Hospital. So in that context, Minister, my second question is this. The HSE have told us that approximately 20% of those in the community who contract COVID-19 access hospital care. Can you confirm, and I've given you this question a few days ago, the percentage of hospital admissions for those in nursing homes or congregated settings who have contracted COVID-19. I really want to hear those figures, because I think if we could get them, they would back up your assurance that those in nursing homes have the same chances on a clinical basis of accessing health care as those in the community.
Thank you very much. So thank you, Deputy Connolly, Deputy Harkin. Just to say to Deputy Connolly, I have to put on the record of this House that whether they appeared in a briefing document or not, nursing homes certainly were a constant source of attention. And the reason I say that is HIQA, who regulate our nursing homes, are on the National Public Health Emergency Team. So the nursing home regulator has been sitting at the table writing and doing a very good job. A lot of the decisions that we've made have rightly focused on older people, a proportion of whom obviously reside in nursing homes. The Chief Executive Officer of the HSE specifically sat down with the representatives of nursing homes on the 19th of February to discuss COVID preparedness. And I'm told by local HSE staff that there was an unprecedented level of engagement by individual HSE officials with nursing homes. That's not to say in any manner or means that enough has been done. We need to do more. I mean, this is a pandemic in which you take actions every single day, and then you take another set of actions, and then you take another set. And that's what we're doing. We're going to have to continue to do more, because we're seeing, not just in Ireland, but we're seeing right across the European Union and the world, particular challenges in relation to breaking the transmission. We're trying to break the transmission of this virus. And it is harder to do that in congregated settings. It's harder to do it. That's not a reason for not doing it. And that's why I've spoken earlier about wanting to test asymptomatic patients, so we don't have to wait for a symptom, we can test and see if you have it. Wanting to look for an enhanced role for HIQA, not HIQA being difficult for nursing homes, but HIQA actually saying these are the standards. Let's make sure everybody can adhere to them. Wanting to look at isolation facilities. If staff are living amongst each other and bringing it from one nursing home to the other accidentally or inadvertently, providing them with alternative accommodation in obviously a voluntary sense as well. On the issue of clusters, I think I'll come back to you if I answer the question wrongly, but I think we need to be, a cluster is 2 or more cases within 72 hours in one setting. And that setting includes, it could be a family home, it could be anywhere. Oh, sorry, I think I heard you ask about clusters, I couldn't hear you properly.
I understand that 2 people tested, there were no more testing done. It was presumed that the rest were going to be affected.
That's not my understanding, but I'll confirm that in writing, but that's not my understanding. In relation to private hospitals and the issue, I issued a letter through my department to the HSE about the importance of continuity of care. You can't just wash your hands of your patient, and whether it's public or private, there's a continuity of care duty. Our doctors take that very seriously, and we've issued that clarification, so I'm happy to take the details of that individual case, but I would not like to see that arise. On the issue of PPE, and I welcome that question, how can Irish companies do more? So the purpose of the website is not to say to people, go off there to the website and be done with you. The idea is that an application form there goes directly to the Office of Government Procurement under Minister Donoghue's department, who can quickly assess the offers of help. Is this something that we could quickly turn around with a business? But if you're experiencing, you know, if there's feedback we need to hear from that, I'd like to hear it as well. We will, of course, reflect on the over 70s and the measures. We always are reflecting on all of the measures. I won't reflect on them, as I'll be guided by Dr. Tony Houlihan's committee, but they'll reflect on them, and they're constantly reflecting. And I'm conscious that, because a lot of over 70s have said it to me, 70 is not old. It's not old, and many people over the age of 70, Gangorla, are perfectly fit and healthy, and they're saying, why are you keeping me at home? We are doing it on the basis of medical advice, but I still understand the challenge that it's posing for them, the very real challenge, and the mental and physical health of people as well. On the issue of CELTA, I haven't seen that point system. I think I read it, but I haven't seen it, and the ethical clinical guidelines are clear. We also have spare ICU capacity today. On the issue of Dr. Lambert, Deputy Harkin, I don't know this man, but he's an expert. and nobody should ever try to silence an expert or dismiss what he has to say. So I intend to reach out to him. I think he's written to me today. I haven't seen the letter yet. I'd like to hear what he has to say. He's an expert in infectious diseases. We should be listening to him. I don't agree, though, that there isn't a plan in place. I've outlined some of the measures already. I've outlined some of the things already being done. But can we do more? Yes. And yeah. Well, if we can join up plans better, we should. So I'd like to hear from Dr. Lambert, and I'd welcome his input in that regard as well. Did I miss out your last question?
Just about the percentage.
Yes. I don't have that, but I'd very much like to see that as well. So let me try and get you that figure this week. Thank you.